UroPatient. Tune in and see. Prepare your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning and welcome to the UroPatient podcast. I'm your host, Vic Senese. Welcome to the show. Hey, be sure to like and subscribe if this is your first time joining us. Today, we're going to be talking about a new product called Altaviva. Now, I just wanted to put out this little disclaimer here. Hang on one second. This presentation is for educational and informational purposes only. The discussion of Altaviva is based on publicly available information and professional opinion. It's not been reviewed, approved, or endorsed by Medtronic and should not be considered official product training or compliant company guidance. The views and opinions expressed are those of the presenter and do not necessarily reflect the views of any employer, manufacturer, or organization. Healthcare professionals should always consult the product's current instructions for use, official training materials, and their own clinical judgment before making patient care decisions. Now, that said, I did talk with the physician who does implantations of these that I had on my UroNurse show. So I decided to make a copy for you, the patient, who I think is a little more easier to understand. So let's take. So if you've been struggling with sudden urges to urinate, frequent bathroom trips, or leakage that disrupts your daily life, you're not alone. Millions of people live with overactive bladder symptoms, but effective treatments are available. Now today I'm going to discuss something called Altaviva, a new treatment option designed to help reduce urgency, frequency, and urge incontinence while improving quality of life. I'll explain how it works, who might benefit, and what to expect during treatment. And I'll also answer some common questions so you can make informed decisions about your bladder health. Now, you're not alone. An estimated 16 million adults experience symptoms of urge urinary incontinence, yet 66% have never discussed their bladder control problems with a healthcare provider, often because of embarrassment or the belief that it's a normal part of aging. Even more concerning, fewer than 4% of those affected receive advanced treatment options, leaving millions to suffer in silence. Good news? Urge incontinence is a medical condition with effective therapies available, and talking to your healthcare provider is the first step towards regaining confidence and improving your quality of life. Now, in many people, urinary urge incontinence happens because of a miscommunication between the brain and the bladder. Normally, the brain and bladder work together, like good friends, allowing the bladder to fill until it's convenient to use the bathroom. With urge incontinence, the bladder may send signals to the brain too early or too often, causing a sudden, strong urge to urinate even when the bladder is not full. Now, this can lead to leakage before you have time to reach a restroom. It may sound surprising, but there's an important connection between your ankle and your bladder. Nerves that pass near the ankle are linked to the same nerve pathways that help control bladder function. By gently stimulating these nerves, healthcare providers can send signals that help reset the communication between your bladder and your brain, reducing the urgency, frequency, and leakage episodes. This approach, known as neuromodulation, offers a non-drug treatment option that can help many people regain better bladder control and improve their life. Now, there are many treatment options available for urinary urge incontinence, and the best choice depends on your symptoms, lifestyle, and personal preferences. Many people start with lifestyle changes such as bladder training, pelvic floor exercises, reducing bladder irritants like we talked in other episodes like caffeine, and managing your fluid intake. Now, if those measures on their own are not enough, medications can help calm the overactive bladder. For persistent symptoms, we even use advanced therapies such as Botox injections into the bladder, interstim sacral neuromodulation, and then, of course, what we're talking about today, the Altaviva tibial nerve stimulation therapy. I really like this slide because it shows that not all bladder treatments are the same. It compares how much daily effort each option requires, how invasive the treatment is, and how it works to improve bladder control, and some of the potential drawbacks to consider. Seeing these differences side by side can help you better understand your choices and have a more informed discussion with your healthcare provider about which treatment best fits your lifestyle preferences and health goals. This slide gives you a great sense of just how small this implant really is. That's a normal hand. Despite its tiny size, it is designed to deliver gentle nerve stimulation that can help improve communication between the bladder and the brain, reducing symptoms of urgency, frequency, and urge incontinence. Because the device is so small, it can be placed with a minimally invasive procedure and is intended to work quietly in the background, allowing many people to go about their daily activities without even knowing it's there. The implantation takes typically about 30 minutes or less. It's done without the need for heavy sedation or general anesthesia. And as you can see from the slide in the middle, the incision is so small that it can often just be covered with a simple Band-Aid. Most patients go home the same day and can quickly return to many of their normal activities. Once the device is implanted and activated, therapy begins immediately, providing continuous nerve stimulation designed to help improve bladder control over time. For someone like me who's needed several MRI scans over the years, one of the most exciting features of this implant is that it's MRI compatible, allowing patients to undergo MRI imaging under the device's approved conditions without having to have it removed. Another major advantage is its convenience. There's no daily maintenance required. You don't have to charge it up every day. The device is designed to be recharged only once or twice a year, making this a pretty low maintenance option. Now, one of the common questions I hear is, how long will the device last? Answer is reassuring. This therapy is designed with an expected lifespan of, get this, 15 years, making this a long-term solution for managing your problem. So, how does it work? Clinical studies are very encouraging. About 80% of patients report improvement in their condition, and around 70% experience a clinically meaningful improvement in health-related quality of life, meaning they felt a real difference in how the bladder symptoms affected their daily lives. In addition, 61% of patients had a 50% or greater reduction in unexpected leak episodes, which is often a major goal of treatment. Now, these results suggest that many patients experience significant benefit, especially when other conservative treatments have not been enough. Now, as much as I like to talk about how promising this therapy is, what really carries the most weight is hearing from patients who have actually lived with it after implantation, their real-world experiences, how their symptoms changed, how their confidence improved, and how it impacted their daily lives provides the most meaningful perspective. When patients report meaningful reductions in urgency, leakage, and disruption to their normal routines, it helps confirm the value of this treatment in a way that data alone cannot fully capture. Now, while this therapy can be very effective for many patients, it's not the right choice for everyone. As shown on the left side of the slide here, the best results are seen in carefully selected patients. On the right, we see certain situations where this treatment may not be recommended, including things like uncontrolled diabetes, progressive neurologic diseases, poor circulation, open sores on the ankle or lower legs, certain metal implants near the ankle, or if the patient requires treatments such as diathermy, that's heat treatments. This is why a thorough evaluation with your healthcare provider is so important to make sure that it's the safest, most appropriate option for you. Now, it's also important to remember that all surgical procedures carry some level of risk, and this therapy is no exception. Reported risks include about a 3% chance of pain at implant site, around a 7% risk of infection, and in some cases, patients may also experience movement of the implant under the skin, changes in bowel or urinary function, or uncomfortable, unintended, or unexpected stimulation sensations. While these risks are relatively uncommon, they are important to understand and discuss with your healthcare provider when considering whether this treatment is right for you. Here's a list of important things to discuss at your appointment so you can make the best informed decision about your care. Be sure to share how your bladder symptoms are impacting your daily life, as well as any medications or lifestyle changes you've already tried. It can also be helpful to bring a record of your symptoms, such as a bladder avoiding diary if you've been tracking them. Ask your provider whether you are truly a good candidate for this treatment and what specific risks and benefits are based on your unique health profile. Remember, we're all different. Finally, this one's a biggie too. Don't forget to ask about cost, insurance coverage, and what steps are needed to determine if the procedure will be covered for you. In summary, understanding your bladder health and the available treatment options is the first step to taking control of your symptoms and improving your quality of life. From lifestyle changes and medications to advanced therapies, there are multiple paths that can be tailored to your individual needs. Most important thing is to start the conversation with your healthcare provider and find the approach that works best for you. Hey, thanks for watching, and don't forget to like and subscribe for more helpful patient education here on the UroPatient podcast. Well, I hope that was helpful. So got to put a little plug in for next week's program. And it's the 4th of July, 250th anniversary for the country. But here's a subject that's a little bit more sombering. It's, sometimes what happens, you can't help. You could end up in an emergency room or worse yet, in a hospital for this holiday coming up. I'm going to teach you some tricks about what you can do.
When a loved one is in the hospital, families often feel overwhelmed, confused, and unsure how to advocate effectively. In this powerful and practical episode of the UroPatient podcast, host Vic Senese sits down to uncover insider strategies that can dramatically improve a patient's hospital experience. Join us on July 4th at 10:30 a.m. Central Time to learn more.
Yeah, so we'll be tackling that next week. So as always, you've got questions, I've got answers. Join us on UroPatient.com, your podcast for your healthcare.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. UroPatient, tune in and see, baby, your health for you and me. Knowledge is power, power. We make it clear every Saturday morning. The podcast is here.